Now we're going to talk about self-harm and the ideas that support it. Self-harm, as you can see from the slide, common acts of self-harm include cutting or burning, but any activity that results in harm to the physical body falls in the category. Acts may seem to be about a desire to commit suicide, but are most often the means by which one is choosing to express the inexpressible. So we're not talking about suicide quite yet, or suicidal ideation. We're talking about self-harm, so it's important to make that distinction. And self-harm, as we've said, is any harm that the student, the participant, does to their own body. It's not about hurting somebody else, it's about their own harm. And cutting is the most common of these. And you may be wondering, why would someone cut on themselves? Well, perhaps some of you have even experienced this. And those who understand this the best actually are those who have participated in it, but have stopped and come back and talk about it. And what they say is, in this particular moment of my life, there wasn't any other way to express the feelings that I had, the emotions that were stirring in me. This was the best way. When I felt the knife or the blade against my skin, I saw the blood, it made me feel something like I was alive. It made me feel something. So oftentimes cutting has to do with an emotional numbness that the person is trying to get in touch with an aliveness. So if you observe these kinds of things, you want to again ask the question, I wonder what's causing the person to want to harm themselves right now. Causes of self-harm can be many and complex, and may be related to other unresolved issues such as anxiety or depression. And those would only be two. Many people cut in order to deal with stress. So any kind of stressor in life can result in someone wanting to cut themselves, burn themselves, harm themselves. One of the most severe cases of this that I've seen is when someone actually bangs their head against a wall until they're really damaged. And you might think, well, that sounds crazy and psychotic, but many times that kind of behavior, when it's isolated, is really about, I need to get out a feeling, and this is the only way I can express it. I can't talk it out, I can't articulate it, I can't express it verbally, but I can do this. And they feel like it's a self-soothing sort of operation. Those who harm themselves may be motivated by a need to distract themselves from inner turmoil or to quickly release anxiety that builds up due to an inability to express intense thoughts or feelings. So again, oftentimes it's not that this is a person who can't communicate or isn't articulate. They often are, but there's some emotional flooding going on, some emotional blocking that's not allowing them to be verbal about it, and so they express it this way. The responses to self-harm, to determine if there is an immediate risk of suicide, is your first option in moving towards self-harm. You want to be sure to delineate, in other words, between self-harm and are they a potential for a suicide risk. So you ask three questions. Do you want to hurt yourself? And that's often a yes or no question, and often you'll get a yes or a no. Do you have a plan? Again, yes or no. And why is a plan important? I forget what the statistics are, but they go way up between someone who says, yes, I'm thinking about killing myself, hurting myself, harming myself in a lethal manner. And then if you ask, do you have a plan to do that? If they say yes, the numbers in terms of the potential for them to actually commit suicide increase exponentially. So you want to, if they say, you know, yes, I do want to kill myself, and I'm thinking about it right now, and you say, do you have a plan to do that? And they say, yes, I can articulate that plan, and here it is. You know, I have a weapon, I have this plan, I plan to do this, this, or this. The more articulate they get about the plan, the more serious you need to take that. Then you ask, when are you considering acting on this plan? For example, they might think, they might not be thinking about timing, but they might. And if you ask them the question, they might even say, I was thinking about doing it today. Or I'm not really thinking about it right now, but I'm thinking at some point I might. So it's either a present or future answer. Listen carefully to the answer to that question. You also want to go into the history of suicidal ideation. So understanding history by asking additional questions. In the past few weeks, have you wished you could die? So you're trying to get a timeline. In the past few weeks, have you felt you or your family would be better off if you died? That allows you to determine, is the motivation for wanting to not be here something outside of them, a relationship, a family issue, a job issue, something like that? Or is it something intrinsic to them? In the past week, have you been having thoughts about killing yourself? How many thoughts, how rapid, how intense and frequent are those thoughts? Have you ever tried to kill yourself? And when we say take a brief history here, it's not like you're sitting there with a notepad taking notes, but you do want to be mentally aware of whether or not they've attempted, whether they have been hospitalized for those attempts, whether or not their family knows about it, and those kinds of questions. Just a history. When and or how was this reported? Are your parents aware? Have you been prescribed medication? The medication question is important too, because if they're suffering from severe anxiety or severe depression or another issue, and they're not being medicated, potentially their risk is higher. Guidelines for selecting the appropriate person to intervene. Whenever possible, find someone with an established and trusted relationship with the participant. If the participant is observed as being sensitive to gender, assign someone that matches their level of comfort. All we're saying here is, you know, a guy with a guy and a girl with a girl is usually the best way to do it. It minimizes complications, but not always. So if someone prefers to be with the opposite gender, that's fine too. There's no bias here on Rustic's part. Protecting the student and stabilizing the situation. Most important thing is if you feel that they're a risk, you want to immediately help them determine what the best cause of action is. For example, if they are suicidal with a plan and they're indicating that to you, in your judgment, that they could really do damage to themselves, you want to isolate that person. You want to do more investigation. You probably will want to call in someone from the administrative team and get a second pair of eyes on this to determine, are they really a risk, and should they either be isolated in the program and stay on program, or should they be removed from the program? You also want to remove hazardous or potentially dangerous objects. You don't want any knives, rocks, anything around that they could do damage to themselves. Assign a Rustic Pathway staff member to remain with the student, especially in an extreme case. A Rustic Pathway staff member who you can be sure is going to monitor the situation and they're apprised of the severity of the case. The PL should always remain visible to others, never alone with the student. It may be necessary to reassign the student to a PL room overnight, but always ensure 2 PLs are present. So we always want to make sure that there's a lot of community around this person. This person should not be alone if you assess that the risk is high. So in this case presentation, in this role play, Dave and I are going to be talking about self-harm. And self-harm takes a number of forms, but we're going to use the illustration of a student who has cut on himself historically, previously, prior to being on the program. So we know that on his med form, he has a history of this. We also know that he is being followed by a psychiatrist and a therapist. So it's not a revelation. It's something we know. And I'm just checking in with Dave to make sure that things are going well enough in the program that he can manage whatever stressors might exacerbate that well enough. So Dave, thanks for taking a few minutes.
Sure.
And so I was notified by a couple students, nobody that is close to you, nobody that you know, that just when your sleeves were up, they noticed some cuts on your wrist. You and I both know that on the med form, you're being followed. This is a historic thing. It's not something that's happened recently, even on the med form. It was a few months ago.
Mm-hmm.
So I'm not worried presently. But I just wanted to check in with you and make sure that the stressors that may be causing some of your anxiety that causes you eventually to cut are at a low point or aren't exacerbated. The program's going okay. You're not feeling particularly stressed.
Oh, I get it. That happened way before program. I was pretty stressed with finals and school and leading up to summer. But yeah, I've already talked to my therapist about it. It's not a big deal.
Good. Yeah, well, you've been cleared to travel, and we feel confident that you'll be fine on the program and all that stuff. Just occasionally when people mention something, sometimes we like to check back in, and it's not something that I'm going to ask you much about anymore, except that occasionally I might want to just check in with you if I see that there's a stressful situation. Like I know that sometimes travel and other things might exacerbate your stress. If I see some of that coming up, I might want to just come to you and say, hey, are you going to be okay? Are you feeling good about how things are going? How's your stress level relative to that activity? Would that be okay?
If you feel you need to, it makes you feel better,
Yeah.
sure. How about it? I don't care. It's
Yeah.
fine.
Okay. It would be really make me feel better more than anything, just to kind of know that I'm kind of following up on that for me.
Okay.
Yes,
I just don't want anybody else to know.
Nope, nobody's going to know. It's just between you and I. I don't need to speak to those students again. I don't think they're going to speak to me.
Okay.
So I think we're good.
Who was telling you about this?
It's a good question. In your case, I would want to know the same thing. But these are people that you don't even know that, you know, they're on another part of the program, and they just, you know, you get together at meals occasionally. And so, you know, really it's, to me, it's irrelevant who they are. It's more that I'm following up for me and for just wanting to make sure that I'm doing the due diligence to, you know, make sure that anybody's concerns or fears are not based on anything real, and they're all historic. And I know that they are.
Okay.
So
Am I in trouble?
Not at all. No trouble at all.
Okay.
Nope. And we're glad you're on the program, and we're so glad that you're managing the stress as well as you are. It's really good.
Okay.
Yeah.
Sounds good. Thanks.
My pleasure. In the role play for cutting or self-harm, we want the role of the program leader or the program manager to actively monitor the student's safety and to determine the student's suitability for the program. We want to help them discover the triggers that cause them to feel like they want to self-harm. And we want to monitor and regularly check in with them for known or developing issues. Another concept, as we think about how you as program leaders and program managers will deal with a potentially suicidal participant. As we said at the front end of this time, your job really is to be a host. And when you're hosting, what you're doing is you're paying very close attention to what the participant is portraying. You're listening to voice inflection, watching body language, you're watching eye contact. You're taking in all this data in order to get an idea of how severe the potential threat really is. But the most important thing is to convey to them a sense of what one of my favorite authors, again, Henri Nouwen, says about suicide. He says, quote, "A person can keep her sanity and stay alive as long as there is at least one person waiting for her. Thousands commit suicide because there is no one waiting for them tomorrow. There is no reason to live if there is no one to live for. One eye movement or one handshake can replace years of friendship when a person is in agony. Love not only lasts forever, it needs only a moment to come about." So your role, if you were to really reduce it to the very minimum, is simply to be present, that they know that there's someone waiting for them, and you're sitting right there with them.